Okay, this is episode 43 of Pelvic Pain Natters podcast. This is a Friday takeaway. So these are shorter snippets of bite-sized chunks of information from me, Karl Monahan. I am the owner of the Pelvic Pain Clinic, dedicated solely to the treatment of male pelvic pain conditions, and the founder of Pelvic Pain Matters, where we educate and support patients and clinicians and anyone with an interest in male pelvic pain conditions. Episode 43 of the Pelvic Pain Matters podcast is my favorite type of prostatitis. Which is an interesting title, to say the least. But there are 4 types of prostatitis. Well, actually 5 if we go through all of the categories. And I'm going to explore today type 4, and I'll introduce it now and say the words to you, and then we'll come back and explore it. So type 4 prostatitis is asymptomatic, inflammatory, so there's an immune response here, prostatitis. Asymptomatic, inflammatory, prostatitis. Asymptomatic means no symptoms, inflammatory means there is the presence of inflammation, so an immune response, and prostatitis means that it is found within the prostate. Itis means that there is either inflammation or infection. Asymptomatic inflammatory prostatitis. It's not very well known of. Surprise, surprise. The prevalence is high, really surprising. But let's take a quick glimpse then at the other types of prostatitis. So back in 1999, the National Institute of Health came up with 4 categories with 1 subcategory of prostatitis. Type 1 prostatitis is acute and bacterial prostatitis. That means symptoms have lasted for less than 3 months, and there is a bacterial component to the presentation. That's type 1. Type 2, chronic bacterial prostatitis. That means symptoms of prostatitis that have lasted for more than 3 months, and there's the presence of bacteria positively found that is residing within the prostate itself. Type 3 prostatitis is now known as chronic pelvic pain syndrome, and we are July 2024. So for 25 years now, prostatitis that is non-bacterial should be referred to as chronic pelvic pain syndrome. So type 3 prostatitis is non-bacterial. That means there is no presence of bacteria found on the appropriate tests when testing should be carried out. And that's the reason why they, back in 1999, changed the term from prostatitis to chronic pelvic pain syndrome instead. It's the most common and the most prevalent of all male pelvic prostatitis presentations, accounting for, depending on which literature you read, certainly above 90%. Some say more than 95%. Some say more than 98% of cases are non-bacterial prostatitis. These are the reasons why patients would go to a GP or urologist. And then there are 2 subcategories. One is inflammatory and one is non-inflammatory. So inflammatory markers are found, presence of white blood cells, for example, maybe an MRI scan that confirms the presence of inflammation in type 3 non-bacterial prostatitis, or what it should be called, chronic pelvic pain syndrome. So type 4, remember, asymptomatic, that means there are no symptoms. Inflammatory, so the presence of inflammation is found. Prostatitis, so it is found within the prostate. Now, the reason I love this type of prostatitis is because it teaches us an awful lot about what does and doesn't happen around the immune response. And certainly for the last 4 or 5 episodes of the podcast, I've been looking at pelvic floor dysfunction. We've looked at the muscles. We've looked at the nervous system. We looked at some evolutionary biology. We looked at trigger points. So this is a bit of a nod to the immune system. because asymptomatic inflammatory prostatitis has an immune component to it. There is an inflammatory response. So the immune system is getting involved here, but it's got nothing to do with pelvic floor dysfunction. All right, zero to do with pelvic floor dysfunction because there's no symptoms. All right. So the reason I'm doing this series about pelvic floor dysfunction is that we need to look beyond the pelvic floor for answers. And if we're only blaming the pelvic floor for the cause of pain and discomfort and symptoms, then we're really missing the bigger picture. I love type 4 prostatitis because it exists. Inflammation can happen in the prostate and there are no symptoms. Patients are asymptomatic. And here's a really interesting fact. The prevalence of this condition is about 1 in 5 men. 20% of men are walking around right now with inflammation in their prostate, but they have no symptoms. The prostate can be inflamed, but the patient doesn't need to have any symptoms. That's bonkers, isn't it? That's absolutely nuts. That goes against everything that we've been told about this condition. Oh, it's inflammation, it's infection, there's something going on in the prostate. That's what's driving the symptoms. That's my point here. Inflammation does not always drive pain. There are many, many more factors that come into play when considering why a patient is in pain. So they identify asymptomatic, because I know you're asking this. They identify asymptomatic inflammatory prostatitis. It began by chance, really. They were doing MRI scans on other parts of the pelvis and the kidneys, I believe, and they started to identify that there was inflammation in patients that were not presenting with symptoms of pelvic pain or prostatitis. So some clever people decided to do a bit more exploration. And there were major studies that came out of America, Northern Europe, and Australia. So if we look at validity and reliability, I think off the top of my head, I think there's about 6 studies that point to this, and the prevalence is about 1 in 5 men. 20% of men that are symptom-free of any pelvic pain symptoms are presenting with inflammation in their prostate. Now, other ways that this can be identified that have been suggested include semen, and I don't like semen analysis. It's often contaminated. It's not the cleanest way of identifying or collecting. It's not the cleanest way of collecting bodily fluids. PSA, if that's raised, can it also indicate if there's inflammation? Just as a side note, did you know that the PSA can be raised from having the common cold, or from ejaculating, or from riding a bike? So we can get inflammation and a raise in PSA from normal everyday activity, and it doesn't result in pain. There are other factors that drive pain. This, as I've already said, is the reason why type 4 prostatitis is my favorite type of prostatitis, because it throws everything against the wind that tells us that this is an inflammatory condition, that inflammation must be driving these symptoms. Other stuff goes on that doesn't cause pain at all. There was even, so just to finish off today's podcast, this is bonkers. So the paper I'm going to refer to right now, the title here from the Canadian Urological Association in 2018 was, do antibiotics decrease prostate-specific antigen levels, that's the PSA, and reduce the need for prostate biopsy in type 4 prostatitis? So what they're looking to do here is they're looking to see if type 4 prostatitis is a precursor for prostate cancer. And so the idea here is, even in the absence of infection, they're using antibiotics to try and reduce the PSA levels that might influence then the possible role in prostate cancer. I mean, it's just so backwards as far as I'm concerned. Let me bring you up the conclusion. So the paper was, like I said, released in 2018. Karel, Karel T. Budding, Buddingh. I've probably said that really wrong, so I do apologize, Karel, if I've pronounce your name wrong. That's on me. But antibiotics are thrown at type 3 prostatitis all the time, aren't they? In fact, if you've had prostatitis or chronic pelvic pain syndrome, like it should be called, then you've probably had antibiotics without even being tested. So it seems like they're trying to do the same thing with this. I mean, it's just bonkers. Remember, there's no infection present. There's no infection present. So this systematic review, and a systematic review is where they take loads of different research papers and they whittle it down to the most important ones that are reflective of what they're looking to prove or disprove within the article. This systematic review demonstrates that patients with type 4 prostatitis treated with antibiotics exhibit a decrease in PSA. Interesting. Due to a paucity of controlled studies, however, there is no evidence that the reduction of PSA is causally linked to the antibiotic regime. Physicians should be aware of the limited evidence when considering antibiotic therapy in patients with type 4 prostatitis. I mean, it just begs the question, why are they throwing antibiotics at a non-bacterial presentation of prostatitis? And I'm being really cynical here, so do bear with me, because they do it with all types of prostatitis. There is an anti-inflammatory component to some antibiotics, and we might see a change in symptoms. Even with classic CPPS type 3 prostatitis, there might well be a reduction in symptoms while someone is taking an antibiotic. Placebo, possibly. Anti-inflammatory, possibly. Other, possibly. We don't know. It's still out. The jury's still out on this. But what I do know is that I love type 4 prostatitis because it tells us so much about inflammation and the role of the immune system in this condition. And inflammation does not equate to every single time a patient having symptoms. For me, that's just gold. Let that sink in for a little bit. I'd love to hear your feedback on this. I really, really would. You can contact me at pelvicpainmatters@gmail.com. You can comment on any of the channels or any of the ways that you're listening to this podcast right now. I hope you've enjoyed it. Like I said, I'd love to hear from you. Thank you very much for your ongoing support. This is episode 43 of Pelvic Pain Natters podcast. My name is Karl Monahan. This has been why type 4 prostatitis is my favorite prostatitis. Catch you next time.